Good afternoon and welcome to our broadcast. I'm your host, Sarah Vaezi, Chief Digital Strategy Officer at Providence. As a reminder, the information provided during this event is for information purposes only. This event does not constitute a doctor-patient relationship, and any questions or medical advice discussed is not considered guidance on what you should do. For any medical questions, please reach out to your primary care or healthcare professional. Now let's begin. I'm very excited about today's event because it is an overview of something that was absolutely extraordinary that our product development organization within the Digital Innovation Group led this summer. Joining me during this live event is Billy Jackson, who is Director of Operations for Digital Product Development and also the Chief of Staff for our product development organization, and David Levine, who is the Associate Vice President for Software Engineering, also within the Digital Innovation Group. And today we're going to be talking about our summer hackathon, which was just an extraordinary, super cool event that I know folks from all across DIG, as well as broader than that, participated in. So thank you both for joining. And David, especially for you, thank you for participating. Unfortunately, Mariam was sick today, so we're really excited to have you.
Thank you.
Awesome. Well, why don't we start with each of you telling me a little bit about your respective roles, what do you do, and how long have you been with Providence? Just introduce yourselves. David, let's start with you.
Sure. I'm Associate VP of Software Engineering at Providence, and I've been with Providence for about 4 years now. And in my role, I've been able to develop something called Dexcare, which is an access optimization platform. So it's a fancy word for saying it intelligently matches health system capacity with digital demand. So it's been great to have the opportunity to scale something new like that, from sort of a concept to several health systems.
Awesome. Thanks, David. And Billy, over to you.
Yeah, so I'm Billy Jackson as the Chief of Staff and Director of Operations. I work across the team to make sure everything's operating as smoothly as possible, but also meant I had the privilege of taking Mariam's vision for the hackathon and leading the execution of it, which was an extremely fun experience. And by way of background, I've been with Providence for 25 years, so I've been with healthcare for quite some time and spent the last 7 in DIG.
Awesome. Well, thank you both again. Billy, you and I have both used the word hackathon now a couple times. Can you tell the folks that are watching, what is a hackathon? Let's start there.
Yeah, sure. So a hackathon is where you take a team, you take a chunk of time, and you get them outside of their normal workflow and challenge them to think of innovative new products that could be developed, and then you go to town for 3 to 5 days and just focus on that creative process and drive that creativity across the team. It's a really great way to make sure that you're always thinking outside of the box, and it also is a really great way to come up with new product ideas that eventually find their way into production over time. You see some open source projects will try to solve big problems, whether they're social problems or technological problems, and here obviously we focus on healthcare problems.
So DIG recently held a hackathon. I think it was just back in September. Billy, could you tell us a little bit more about what the vision was for the hackathon? I think you all pulled off something really extraordinary, which was 100 projects during the hackathon or something along those lines. So can you tell us a little bit more about what the vision and goals for this event were?
Yeah, so we really wanted to open things up across teams and engage some of our partners. We've always done hackathons at DIG as long as I've been here. So this time, though, what we said is, look, we want to take this to the next level. We invited our IS team members to join us. We had folks from Microsoft join us to help out. And so the idea was really engage as many people as possible and kind of cast as broad a net as possible. So we did wind up with 40 projects being finished after 5 days, which is incredible. That's 2 to 3 times more than we'd ever seen in a previous hackathon. And along with kind of driving that creative process and getting a lot of good product ideas out there, ideas for helping providers and patients and each other. The other cool thing about it is it also gives the team an opportunity to have fun. and enjoy enjoy working with each other like they do every single day, but form up different teams, work with people they haven't before, and kind of build on that together.
Very cool. Can you tell us a little bit more about, like, paint a picture for us? What did those the duration of the hackathon look like? Like, what was the how did it start? How did it finish? Like, what were the days like for folks? And especially, it would be really great if you could share with us, how is this a little bit different from what you've done in the past, given that it was virtual and folks weren't actually in it together? I know when we've done this in the past, folks were like sleeping at the office, and spending several days together nonstop. But just if you could paint us a picture of that and walk us through what those days look like.
We kind of approached it in some respects like a product. So thinking about what's it going to take to do this virtually well ahead of time, and then meeting with like the IS team, the other teams that we invited to join us, and kind of get the word out there and market it really, really heavily ahead of time. And so what we did is we made sure and get the word out. Then what we do is people would come up with ideas, take that time to think through ideas, and put together basically product pitches. Like if you're approaching a venture partner firm, put those out there. We had some infrastructure that allowed us to kind of share that information, and then teams kind of organically formed up around that. And that's how those 40 teams got formed, actually 40 plus over time. So then what we do is after those teams kind of organically form, we had a kickoff meeting virtually. We leveraged our Teams infrastructure. We had some help from our Microsoft partners to figure out how best to use that, and got things kicked off. We really heavily leveraged Teams video. We used SharePoint and actually Teams chat to make that work. That was really interesting. We did a lot of research ahead of time, and picked the brains of a lot of people who've done hackathons across different time zones, for example. Because this time around, we actually had 3 different countries across 2 continents worth of folks joining us. So we had a rather large team that we have, the IS team has in India joined us. And so that's really what made that coordination, quite frankly, possible. Otherwise, if we're doing things physically, like you were talking about, like we've historically done them before inside our own 4 walls, that wouldn't have been even possible. And a lot of the teams that actually did the best were the teams that actually spanned time zones. We had a lot of teams that were made up of folks from India, and from folks from Seattle, and from folks from California, for example. Then after that, basically, those teams we gave them 5 days to put together their product. And at the end of that, which is amazing, that's an amazingly short amount of time. That's half of what a normal development sprint is for us. At the end of that, all those teams put together video demos for their product. They gave we set up 3 sessions, 3 days worth of live demos to cover 40 products, and asked our judges to sit down and review those and submit their feedback. It was super exciting.
Yeah, speaking from the perspective of one of the judges, I can say I was very inspired and just blown away by the quality, the mission-driven nature of it, just like everybody's passion for what they were doing. It was really fun to see. So you mentioned, there were just a lot of ideas and teams kind of came together organically. How did you or the teams define what they were going to work on? Like, where did those ideas come from?
So they actually come from the teams themselves. So what we do, though, is we give folks kind of some categories, right? So we focused on 3 different areas that a given team could work on. One was a project you might pitch that could help providers, doctors or nurses, or people who are taking care of people, right? A second category would be directly to consumers and patients. What's a product that would face those folks and make getting healthcare in a way better fashion work well for them. But the third one that I'm actually super passionate about and love is, what are products that actually help our teams or other teams inside of products that support providers do a better job or turn things around really quicker. A really good example of that is one project that we had was about doing deployments in a faster and safer fashion in a production environment. And while consumers don't see that, providers don't see that directly, what that means is we're making our software deploy fast. We're also doing it in a way that reduces the amount of risk That means we can deliver features faster, and also means we deliver them more consistently. And so that's an example of one of my favorite projects, because it also saves the developers time. It means they're staying up at midnight less often because their tool set is better.
Very cool. So you referenced something just now. We talked about judging. We talked about video demos. So I assume that there were winners. What were some of the kind of categories for the awards, and what were the criteria for who won and why?
Yeah, so we actually had quite a few different awards. So in our partnership with IS, we had a CIO's Choice Award. We also had Chief Digital Innovation Officer's Choice Award. So BJ Moore on the CIO side, and then Aaron Martin got to choose projects that resonated with them the most. One of my favorites was our Chief Mission Officer Award. So Sister Suzanne, who's a sister of Providence, actually got to pick one of the projects as well. And that's especially fun and inspiring. You can go on our website and actually see a video where Sister Suzanne talks a little bit about that. That's especially fun because whether you're in India, whether you're in Seattle, whether you're in Oregon, anywhere in Providence, people of Providence care deeply about the mission. And then we also had some other awards about just first, second, and third place overall. And we also had a fun video award. Every team was allowed to do something just for fun too, to kind of release some steam and sort of show off how they got together as a team and enjoy working with each other. The criteria, especially for the first, second, and third place award, we do, while we have a ton of fun, we also look at things like practically, like how big an impact would this product have when it goes into production? How easy is it to scale that? So not only how big an impact would it have on the users, but how easy can we multiply that effect? We also ask ourselves, how close is this? In 5 days, how close did you get to being able to go into production? We don't constrain things to just what we could release to production, but that's a characteristic too. And we also look at how innovative is this? How disruptive is this to the way that healthcare is delivered now? So those are just some of the guidelines that the judges are given. But it really, and we release those to the teams ahead of time so they can think about that when they're making their pitches and when they're developing their products in those 5 days.
Awesome. So I'm going to mix it up a little bit. David, you were more of a hacker in this whole process and during those 5 days. Were the outcomes of the hackathon kind of what you expected? Were there any interesting little things that maybe surprised you? Tell us a little bit more about your experience as a participant and as a hacker.
Sure. I think one of the first outcomes was engagement, and like Billy said, and I mean, I expected people to be engaged, but whoa, we got a really great response, and both in terms of the number of people who sort of submitted, or as hackers, and then also the ideas that came through, really good quality ideas, which made the judging very hard this year. The other thing that I was impressed by was, one of the goals we have is to allow, especially engineering staff like me, which I also do, to do training. So like if I want to learn a new technology stack, this is sort of a safe environment to do it where you're making something real. So for example, one of the winning teams was a group of mobile developers who wanted to do, they delve into areas outside of their comfort zone related to server side, speech recognition and AI, ML, that kind of stuff. So they got a chance to do that, and their idea actually won an award this year. So yeah, I think it was a great experience.
Very cool. So kind of like that spirit of learning, the experimentation, doing so in a safe way, and sort of in an unconstrained way almost, right? You like focus, you get to just do that for a 5-day period and that's it.
Yeah, and one of the other things that's interesting about it is it also gives you a safe place to try out ideas that don't work. So the idea that I had this year, I was sure would work. It was actually a big part of what we were planning to do. And I'm like, okay, well, I'm going to try this out and learn how it works. And we spent a few days on it, and it turned out that there were constraints that we didn't even know about. So in a period of 2 days, we really got a lot of answers, which I think is another great outcome, that we had, to something that we sort of assumed would work and be good and wasn't. Yeah.
Can you tell us what that was, just a little bit?
Yeah, it was a new way to do urgent care queuing. So that's one of the problems that comes up is there's a lot of manual process in that, more than you would think, and we figured that we could have a way for people to sort of insert themselves into a queue from a digital mobile device, and then have that processed automatically for doctors. And it turns out that the method that we thought would work for this, integrating with the medical record system, wasn't actually ready for production. We could make it work. We were able to hack it, make it work. But the thing is, we discovered that, okay, this isn't really ready for prime time and isn't something we'd be able to depend on for production patients.
Got it. And Billy, what about from your perspective? Were the outcomes what you expected? Were there any surprises on your end?
I think one of my favorite things to see is how quickly different teams came together. I'm not surprised because we're all people of Providence, but I kind of expected teams to gravitate just towards people they worked with on a regular basis, and that isn't what happened at all. There were a lot of really super diverse teams that were learning from each other, and some of the teams that did best actually incorporated people from multiple geographies and from multiple teams that they don't work with on a regular basis. So I'm surprised, but I'm not surprised. It was fun to see. I was just pleasantly surprised with that. And the other thing is just the raw volume of projects that all were very, very focused and dedicated on one of those three key things, either helping patients, providers, or each other. That was super inspiring for me. And then, and the other thing I just want to say is the amount of work that the planning team. So I was tasked with leading the implementation, but by no way, shape, or form did I do that alone. The dedication, passion that the other people on the planning team put into it. We had about 10 people on that planning team, and just hours and hours of work to make that cook. It was fun to see the hackathon itself come together almost like a hackathon project and deliver sort of as a meta hackathon as well. And we're going to be able to reuse all of that infrastructure that team came up with to be able to do this more often. So
that's awesome. And I think it speaks to sort of the hackathon not just being some little thing that you do every now and then, but really as a core part of the spirit of innovation that you all deliver on every day, but then in these sort of specific focus settings a couple times a year as well. So that's really cool. And I can say also, a couple folks from my team who often don't get to work with engineers or product managers participated and just had such a great time, not only getting to know the folks, but seeing how product is built and the ways by which those teams kind of came together was really inspiring and had some great outcomes, right? Products that could actually potentially be used in the future. So that's really cool. And so on that note, from your perspectives, David, let's get back to you. What do you think were some of the most exciting discoveries that you saw come out of this?
Yeah, often the most exciting discoveries are those little things that you can do that make a big impact that no one realized. So actually one of the projects, for example, one of the winners had to do, they decided to tackle the topic of suicide prevention and treatment, and they digitized a technique, for safety plans that made it more accessible, to both patients and providers, which, once they put it together, it's of course that's going to really help people. And it was a really they completed a lot of work. I mean, it wasn't an easy thing to do, but I guess what impressed me was how inspiring it was to see that something like that could have such a big impact on a major problem.
Yeah, that's a great example, and I know that team also just learned a lot about some of the nuances of delivering some of these things into our ministries. Like once it was built, then there were other questions that came up. So being able to do it in such a fast, focused way surfaced all sorts of other things that then we could build on going forward. Billy, what about you? What do you think were some of the most exciting discoveries or outputs of this, whether it was like a specific project or something else?
So there were so many projects that were focused on just the mission and taking care of people. One project just around women's safety during travel kind of rose to the top. Another example would be like some of the projects, again, that were around simplifying things like putting together integrations for different EMRs. All those things together, their cumulative benefit is huge. One of the things, though, I think that stuck with me really strong, Sarah, is in some of the fun videos, the teams focused on how it is they came together and interacted, and that provided me with a ton of joy, just seeing people walk through the process of how they would agree, how they would disagree. There were some people that had ukuleles involved in those videos. And I think the reason that resonates with me so much is I think that is a reflection of the passion that everyone puts into their products and the work here every single day, just kind of being able to focus and like you said earlier, get some focus time away just to, in a safe way, to like dedicated to this sort of work. I think that makes it bubble to the top. But yeah, to too, that really made a difference. Like you see things like AI voice transcription automatically going into medical records or virtual visits is being put together like that. We're not healthcare. When I started 25 years ago, used to be fairly far behind, and it's not anymore. It's not anymore, and that's so exciting for me.
I think we all share in your excitement, and it's long overdue. So totally get that. So I know one of the things that hackathons, like one of the benefits that they provide is that some of this actually can be applied to development going forward, right? It doesn't just live within the constraints of the hackathon and then go away. It actually endures. So how, David, from your perspective, how will either the learnings from the hackathon or specific projects kind of be applied to development going forward?
Several of the products that we've developed actually started as hackathon projects. So like I think, the hardest part is often to just get started, to get the ball rolling and see what's possible. So, that is a major benefit of the hackathon. So for example, our digital health assistant, Grace, that's with Providence, came from a hackathon project. I think also Billy mentioned sort of part of the judging criteria is how readily the projects can be applied in production. So and that can be not just new products, but just better ways of doing things. Like for example, one time, one of the winning projects was a way that we used to automatically track uptime for Dexcare and monitor and report to our customers so we could improve our operational effectiveness, which is actually still in production today. So that was something that was developed in a hackathon in 3 days, and we put in production soon after, and it's still there. So I think often the ideas get used, after the hackathon or kindle something new.
Yeah, and that's great. So like both specific products can blossom into something bigger, and there's just learning around how to work and how to do specific things that can that can have an impact on existing products that you're already working on going forward. That's great. Billy, how about you? What do you think in terms of how this will impact either product or the way that work is done and product is built going forward? How do you think the results of this hackathon will kind of translate into that?
I think there's three different ways. The first one Dave already got to, which is some of the code winds up in production, or winds up in production or in the products we're developing today anyway, right? That's one of the low hanging fruits that's always super exciting. The other way is sometimes it spawns new ways of thinking about problems that can lead to brand new products or product lines or ways of thinking. And I think, I think a product, Viva Grace, which is basically taking some of our COVID chatbot technology and making it more accessible to the poor and vulnerable. I think thinking about those populations and sustainable ways to help those folks is really exciting. So I think that gives us the opportunity not just to say, how does this thing we built fit into our existing code or start a new product, but also how do we think about problems in a new way? That was really inspiring for me. And important. And then I think the third way is it really just helps us reinforce the DNA in our culture of just of actually being innovative, that this is not just something we do during hackathons. This is really just a focused version of what we do every single day, and keeping that hardwired and keeping that part of our culture like moving forward, and being able to highlight that in this fashion is super helpful.
Awesome. We're almost out of time, but David, don't mean to put you on the spot, but I'm going to ask you a question that wasn't predefined, which is, you mentioned Dexcare a couple times. What is Dexcare? You said it's access optimization, but can you tell us just a little bit more about it? I know you've been working on it and pouring a lot of blood, sweat, and tears into it for quite some time. So can you tell the audience what it is and why it's important?
Sure. I like to think about it as making it easy to get healthcare, just like you would, book a table at a restaurant or an Uber or something like that. So what Dexcare does is it makes it easy to book several different types of appointments. It could be virtual, in person, or having providers come out to visit you. So through several modes. And then it also matches, the available capacity of the health system to that demand. So you might have, for example, some clinics, you have some dedicated virtual providers. If the virtual line, let's say, or the providers get really long, we can move some of that capacity to clinics that might not be as busy. And so as a result, everybody wins because patients get seen quicker. The health system can keep costs under control, and everybody has a better experience.
Yeah, and I would just add to that, like, I think, when folks hear booking, they think of like a pretty simple problem, but it's actually a very complex problem, especially as you add in, like you said, new modalities, right? It frees up, there's so many degrees of freedom and so much compounding complexity when you add in video and in person and chat, and that chat could be human powered, it could be AI powered, it could be synchronous, it could be asynchronous. And so it really creates this very complex problem. And then you have to match what people are looking for to what capacity is available within that really complex problem. So I just wanted to highlight that because it's a really fascinating and difficult problem to solve that nobody has done it in sort of this like really integrated, non-fragmented way. And Dexcare has done that. And a lot of that, can be attributed to the work that you've done, David, and the effort that you and your team have put in. So it's just really cool. I don't want people to think, oh, it's just booking. More than that. Awesome. Well, with our last minute here, anything that we didn't touch on that you all want to talk about and spend a little bit of time on? David, let's start with you.
Well, just wanted to mention that, we're hiring engineers and product people at all levels. So if these types of problems we've been talking about interest you, I'd love to hear from you, and you can reach me on LinkedIn.
Awesome. Billy, any final words from you?
Same as Dave. We're always looking at new people looking for new people who want to come join us and join our hackathons eventually, and be a part of this team. It's a really exciting place to be.
Yes, and I would kind of echo both of your sentiments and just say, for folks out there, if you're interested in solving problems around digital access and convenience, navigation and personalization, problems in the behavioral health space, or problems in the how we serve our underserved patient populations and communities, we're working on all of those. and want to hear from you and want to engage with you if you would love to join us. So thank you so much to David and Billy for joining me today, and to everyone out there for listening and sending your questions, which we'll take a look at and get to. If you have any questions, and if you want to learn more about our initiatives, any programs or services from the Digital Innovation Group, or if you would like to potentially come work with us, go to www.providence-dig.org. Or if you want to learn more about Providence in general, go to providence.org, and make sure to follow us on social media at Providence Health System for LinkedIn, Facebook, and Instagram, and under Providence on Twitter. And with that, thank you, everyone, and have a great afternoon.
Thank you.